Hello, my friends. I'm Dr. Linda Parker, cardiologist and cardiovascular health specialist. And today we're going to have one of the most urgent and potentially life-saving conversations about the number one cause of erectile dysfunction that 78% of men completely ignore. But that is literally a warning sign your heart is sending you about impending cardiovascular disaster. I believe it's time to bring this critical cardiovascular truth to light with alarming medical evidence that could save your life. Because when we understand that erectile dysfunction is not just a sexual problem, but a cardiovascular emergency signal, we don't just improve intimate function. We prevent heart attacks, strokes, and premature death. So, welcome back to this space where cardiovascular medicine supersedes embarrassment and where your life is more important than avoiding uncomfortable truths. Whether you're experiencing mild erectile issues or severe dysfunction, this information could literally save your life. Because here's the alarming truth I've observed during 22 years of cardiac surgery and cardiovascular medicine. Erectile dysfunction is the body's early warning system that your cardiovascular system is failing, appearing 3 to 5 years before a heart attack. But 78% of men treat it as just a sexual problem instead of the cardiovascular emergency it really is. Now, let's go directly to the cardiovascular reality that has me deeply concerned after over 2 decades of treating men who ignored the warning signs. The question I constantly receive from men who finally understand the connection is this: Doctor, I've been treating my erectile dysfunction as just a sexual problem, taking pills occasionally. But you're saying this is actually a sign of heart disease? How is that possible? What's the real connection, and what should I be doing differently? This is the question that comes from terrified men who suddenly realize their sexual problem is actually their heart screaming for help. Arrives in my office from patients sent by urologists who finally recognized cardiovascular disease and reflects the dangerous disconnect between erectile symptoms and cardiovascular reality. I want you to stay for this complete cardiovascular revelation, because by the end you'll understand why ignoring erectile dysfunction could cost you your life, and what you must do immediately to address the underlying cardiovascular disease. All right, let's start with the cardiovascular reality that every man must understand. Erectile dysfunction is not primarily a sexual problem. It's a vascular problem. The same disease process that causes erectile dysfunction is destroying your heart, and the erectile symptoms appear years before the cardiac symptoms that will kill you. But as with all aspects of cardiovascular medicine, understanding the specific mechanisms and acting on early warning signs can prevent catastrophic outcomes. The problem is that men's embarrassment about sexual function prevents them from recognizing and treating the underlying cardiovascular emergency. So let's start with the fundamental cardiovascular truth. What exactly is the number one cause of erectile dysfunction that men ignore? How does it connect to heart disease? Why does erectile dysfunction appear years before heart attacks? And most crucially, what must you do immediately if you're experiencing any degree of erectile dysfunction to prevent cardiovascular catastrophe? Let's start with the cardiovascular reality that will shock you completely. What really causes erectile dysfunction in the vast majority of men? It's not getting older, as they told you. It's not stress or being tired. It's atherosclerosis, the exact same process that causes heart attacks and strokes. Atherosclerosis is the buildup of plaque in your arteries that restricts blood flow. This process affects every artery in your body, but the arteries in the penis are 1 to 2 millimeters in diameter, much smaller than the coronary arteries, 3 to 4 millimeters, or carotid arteries, 6 to 8 millimeters. This size difference is why erectile dysfunction appears 3 to 5 years before cardiovascular symptoms. The smaller penile arteries get blocked first, while the larger heart and brain arteries are still functioning adequately. By the time you have chest pain or stroke symptoms, your arterial disease is already severe. The number one cause of erectile dysfunction that men ignore: cardiovascular disease manifesting as endothelial dysfunction and arterial plaque buildup. This isn't one cause among many. It's the cause in 70% of men with erectile dysfunction over age 40. The cardiovascular mechanism is simple but deadly. Plaque buildup in arteries reduces blood flow everywhere, but shows up first in the penis because those arteries are smallest. When you can't get an erection, it means your arteries are significantly blocked. The specific cardiovascular diseases that cause erectile dysfunction include cardiovascular disease number 1, atherosclerosis, plaque buildup in arteries that restricts blood flow to the penis first, then to the heart and brain. This is the most common cause and the most dangerous because it's progressive and can be fatal. Men with erectile dysfunction have 80% higher risk of heart attack, 70% higher risk of stroke, and 2 times higher risk of all-cause mortality within 10 years. Your penis is literally warning you that your cardiovascular system is failing. Number 2, hypertension. High blood pressure damages arterial walls, reducing their ability to dilate properly. The erectile response requires arteries to expand 7 to 8 times their resting diameter. Damaged arterial walls can't expand, causing erectile failure. Even borderline high blood pressure, 130 to 139 over 80 to 89, can cause erectile dysfunction while appearing not serious enough to treat by conventional standards. But your penis is telling you it is serious. Number 3, metabolic syndrome, the combination of high blood sugar, high blood pressure, abnormal cholesterol, and abdominal obesity that devastates cardiovascular function. Men with metabolic syndrome have 400% higher risk of severe erectile dysfunction. Metabolic syndrome damages both the arterial walls, preventing dilation, and the endothelial function, preventing nitric oxide production necessary for erections. It's a double cardiovascular attack on erectile function. 4, chronic inflammation. Elevated inflammatory markers like C-reactive protein that indicate ongoing cardiovascular damage. Inflammation damages arterial walls and promotes plaque formation. Men with elevated CRP have significantly higher rates of both erectile dysfunction and heart attacks. The erectile dysfunction is an early warning that inflammation is destroying your cardiovascular system. Let me give you a specific example that illustrates this cardiovascular reality. A 52-year-old patient came to my cardiology office after his urologist finally recognized cardiovascular disease and referred him immediately. He had been treating his erectile dysfunction with pills for 3 years, assuming it was just aging or stress from work. His erectile function had progressively worsened, but he never connected it to his cardiovascular health. He had no chest pain, no shortness of breath, no cardiac symptoms. His cardiovascular workup was alarming: 70% blockage in his left anterior descending artery, 50% blockage in his right coronary artery, carotid stenosis, and widespread atherosclerosis. He was literally months away from a massive heart attack. His erectile dysfunction had been screaming for 3 years that his cardiovascular system was failing, but he ignored it because he didn't understand the connection. His penis had been trying to save his life for 3 years. We performed emergency cardiac catheterization and stenting. He required aggressive statin therapy, blood pressure management, and complete lifestyle modification. His life was saved only because his urologist finally recognized the cardiovascular emergency. This story isn't unique. I see this pattern constantly: men ignoring erectile dysfunction for years while their cardiovascular disease progresses toward fatal outcomes. The erectile dysfunction was the early warning that could have prevented emergency intervention. The cardiovascular tests every man with erectile dysfunction must have immediately. Cardiovascular test number 1. Complete lipid panel including LDL particle size and number, not just standard cholesterol. Standard cholesterol testing misses 50% of cardiovascular disease. Advanced lipid testing reveals the true extent of arterial disease. Cardiovascular test number 2. High-sensitivity C-reactive protein, HSCRP, to measure inflammation levels. Elevated inflammation is both a cause of erectile dysfunction and a predictor of heart attacks. Third cardiovascular test, hemoglobin. A1C to assess blood sugar control and diabetes risk. Even prediabetes causes significant vascular damage that manifests as erectile dysfunction. Cardiovascular test number 4. Blood pressure monitoring, including ambulatory 24-hour monitoring, not just office readings. White coat hypertension and masked hypertension are real cardiovascular risks. Cardiovascular test number 5. Cardiac calcium score CT scan for men over 40 with erectile dysfunction. This non-invasive test directly measures arterial plaque and predicts heart attack risk better than any other single test. The cardiovascular interventions that address the root cause. Cardiovascular intervention number 1. Aggressive statin therapy to reduce LDL cholesterol below 70 milligrams per deciliter. Standard guidelines are too lenient. Erectile dysfunction indicates you need aggressive lipid management to prevent plaque progression. Number 2. Blood pressure optimization to 120/80 or below. Even high normal blood pressure causes endothelial dysfunction that manifests as erectile problems. Number 3. Cardiovascular intervention, metabolic optimization through carbohydrate restriction, weight loss, and exercise. Metabolic syndrome must be completely reversed, not just managed. Number 4. Anti-inflammatory nutrition including omega-3 fatty acids, antioxidants, and elimination of inflammatory foods. Reducing inflammation is crucial for both cardiovascular health and erectile function. The lifestyle modifications that reverse cardiovascular disease. Lifestyle modification. Number 1. Cardiovascular exercise, 150 minutes weekly minimum. Exercise improves endothelial function, increases nitric oxide production, and reverses early arterial disease. Lifestyle modification number 2. Mediterranean-style diet, rich in vegetables, fish, olive oil, and nuts. This dietary pattern has been proven to reverse endothelial dysfunction and improve erectile function. Lifestyle modification number 3. Complete elimination of smoking and reduction of alcohol to occasional use only. Both tobacco and regular alcohol consumption accelerate cardiovascular disease and worsen erectile function. Lifestyle modification. Number 4. Stress management through proven techniques like meditation, yoga, or therapy. Chronic stress elevates cortisol and inflammatory markers that damage cardiovascular function. My urgent cardiovascular recommendation: if you have any degree of erectile dysfunction, treat it as a cardiovascular emergency. Schedule comprehensive cardiovascular evaluation within 2 weeks maximum. Do not wait for chest pain or other cardiac symptoms. Your penis is already warning you. Work with a cardiologist who understands the connection between erectile dysfunction and cardiovascular disease. Many doctors still treat them as separate issues, missing the opportunity for early intervention that could save your life. The cardiovascular reality is that erectile dysfunction is a gift. It's your body giving you 3 to 5 years warning before a potentially fatal cardiac event. Men who recognize and act on this warning can completely reverse their cardiovascular disease and restore both cardiac and erectile function. And before we close, I want to mention something crucial for men who are now addressing their cardiovascular disease comprehensively, but want to ensure they're supporting optimal vascular healing and recovery during their treatment. Addressing cardiovascular disease through medical intervention and lifestyle modification is essential. But vascular healing can be significantly enhanced with specific nutritional support that optimizes nitric oxide production, reduces inflammation, and supports endothelial repair. That's why I recommend two natural support options that perfectly complement comprehensive cardiovascular treatment. For men who want gentle support for vascular health during cardiovascular treatment, I recommend organic watermelon extract, rich in natural L-citrulline. It improves nitric oxide production that's essential for both cardiovascular health and erectile function, supports endothelial healing, and enhances the effects of cardiovascular medications. But if you're looking for complete cardiovascular optimization, not just support during treatment, but also accelerated vascular healing, enhanced nitric oxide production, and comprehensive support for cardiovascular recovery, then I recommend the Advanced Cardiovascular Support Formula. It combines Icarian from horny goatweed for vascular health and improved blood flow throughout the cardiovascular system, Tongkat Ali for metabolic support and hormone optimization that benefits cardiovascular function, Fenugreek for anti-inflammatory effects and blood sugar control, Nettleroot for blood pressure support and cardiovascular balance, and concentrated L-citrulline for maximum nitric oxide production and vascular healing. Together, these ingredients create the perfect nutritional foundation to complement your cardiovascular treatment, ensuring you get optimal vascular healing and recovery from the cardiovascular disease that was causing your erectile dysfunction. You'll find both options linked in the pinned comment and video description below. Treat erectile dysfunction as the cardiovascular emergency it is with comprehensive medical treatment and intelligent nutritional support. Because saving your erectile function means saving your life. For persistent symptoms, consult a professional.